Plasma, which is the liquid part of blood, has proteins called antibodies, which are typically produced by the body in successive waves to combat infections, typically, say in this case, viral infections. And the way these antibodies help in treating a viral infection definitively is by neutralizing the virus, so they're called neutralizing antibodies. So the premise here is that plasma from patients with proven COVID-19 infections who recovered from the infection after a period of 10 to 14 days would have mounted an immune response sufficient enough to hopefully protect them, and therefore those antibodies could be used to protect other people. We do not have those answers refined for COVID-19 yet. We know those people produce antibodies. We don't know if they're neutralizing antibodies. We don't know how long-lasting they are. We don't know if they will protect from reinfection. That is all being studied by experts around the country and the world.
When should doctors consider this treatment for COVID-19 patients?
We're considering it early in the course of disease. So typically within a few days of hospitalization is what is we think would be ideal. So we use it. It's only used for patients who are hospitalized. It's not at the moment available for patients who are feeling well and at home with proven COVID-19 infection.
Is this treatment being used at Avera or in this area?
It is being used at Avera, yes. The donors should be at least 14 days from the last reported symptoms. And sometimes it can take up to 28 days before they can donate. But what this therapy will prove to us is the safety and the efficacy of doing it. And, they will be looking at the antibody titers on all of these patients once that information becomes available, and then they will try to marry to the information to see if those particular units produce better benefits or not. It has worked before for other viral illnesses. I don't think we can extrapolate that to this one. All we know is it can be done safely. That's the preliminary data. The efficacy will be demonstrated when we get the published results, when all the patients' experience have been analyzed. This has been the only antiviral approach of any proven benefit in viral infections available to be tried in COVID-19 patients to date.